Have you ever had an infection in your stomach? Well, I have, and let me tell you, it is wildly uncomfortable, and I can tell you with certainty that many people have this issue because they seek me out for help after they've had multiple failed treatments that sometimes left them worse off. In this video, we're going to talk about an intro to small intestinal bacterial overgrowth, but before we get started, I'm Dr. Zarowski, and welcome to the channel. Be sure to subscribe, hit that notification bell, and remember, you got to hit that bell, otherwise, well, you never know when new videos come out. And then if you want to take control of your health naturally, and I highly recommend this, go over to www.drz.tv and you'll find a whole library of natural health videos that will help you start your transformation today. And also, one more thing before we get started, do me a huge favor, smash that thumbs up button because you're going to like this information and it's going to be transformative, especially if you have this problem currently or if maybe it is in your future, which is very, very likely due to the high number of people who have it. Now, let's dive in. The human digestive system is a mighty and miraculous yet delicately balanced realm. It doesn't take much to disrupt the microbiome and create a tangle of uncomfortable and disruptive symptoms. Bacteria are a critical component of a healthy gut and the small intestines, but when bacteria overgrow in the small intestines, oh, does it cause problems? It can cause leaky gut and a whole host of other issues. And let me emphasize how important this is because I do a lot of work helping people overcome gut problems. I mean, it's the number one thing that people seek me out for. And you can take bacteria, and I'm speaking on probiotics and bacteria in the stomach, how important it is. You can take a probiotic and introduce it into somebody who's obese and they start losing weight. You can take a certain strain of probiotics and introduce it to somebody who has insulin resistance and they start to overcome insulin resistance. You can take a probiotic and introduce it to somebody who has a chronic disease and they start to overcome many of the issues associated with that chronic disease. Probiotics in certain strains are wildly important for the body and they play such a huge role in our overall health. Many Americans experience intense or unspecific abdominal pain along with bloating and irregular bowel habits. Quite frequently, the cause of these symptoms is a common but often misunderstood condition that can wreak havoc on your body, and that's known as SIBO, and that stands for small intestinal bacterial overgrowth. So this is something that's really important. So the small intestines, it's important to understand their job. The job of the small intestine is really to sit there and digest your food. So when you eat a whole bunch of food, it is going to digest all those nutrients so that you can break it down. Like you are what you eat. You literally are what you eat because whatever you put in your body breaks it down and that becomes you. It becomes a living cell, which is truly incredible when you think about how that works. But the other thing that's important is the small intestine is wildly important for a whole bunch of other reasons in your body, for how your brain's working, how your hormones are, but especially how your immune system is functioning because it's estimated that upwards of 80% of your immune system is located right in your gut. So when you start talking about having immune disorders and people having just an overall lack of a healthy immune system, a lot of it comes from the gut. If you start having problems where you find rashes on your skin and your skin looks really horrible, you have really bad acne, you can always look at skin problems and take them back to the gut and go, what is going on here? So we have to realize very important for your immune system. And with all the stuff we dealt with over the past 2 years, a certain virus, well, your immune system was real important to make sure that you had things in working order. Now, as we look at SIBO, let's talk about what it is. Now, we talked about most of the food being digested in the small intestine. Well, a lot of bacteria, pretty much most of the bacteria is in the large intestines within the gut. And you're going to have very, very little bacteria within the small intestine. But with SIBO, what happens is much of the bacteria from the large intestines makes its way to the small intestines, and it causes a huge bacterial overgrowth. It's not supposed to be there. And so when it gets in there and there's all that food in there being digested, let me tell you, it really likes it. And it stays there and hangs around. And we'll talk about the symptoms it causes in just a moment. And we'll also talk about my personal story with this so that you can understand kind of what I've went through. Because as I mentioned at the beginning of this video, I've been through this. It's horrible. And unfortunately, most doctors have no clue what it is, and they typically put you on rounds and rounds and rounds of antibiotics that just destroys your body. And so SIBO is complex. And in this article, it says the cause of SIBO is often a complex combination of issues such as decreased intestinal motility, low stomach acid, poor immune function, dysfunction in the ileocecal valve. Let me tell you, the list goes on and on and on. It's very important. And I tell this people all the time when we start working on their gut issue, look, when it comes to SIBO, it can be coming from 10 different directions. It's no easy answer because people go, Dr. Zarowski, how did this happen? What is it that caused this? Well, I mean, I don't have a crystal ball, and it's hard to tell, but at this point, we just got to fix it, you know? So once the food that you consume is broken down in the small intestines, it makes its way to the large intestines, and in a healthy digestive system, there's a high concentration of many bacteria strains in the large intestines. Now, sometimes this bacteria migrates backwards due to malfunction of the ileocecal valve, as we had mentioned, and it creates this massive infection in the small intestine. And then, once we have that issue, a lot of other things start to happen. In any of these scenarios, bacteria species, whether too much or the wrong types, in the small intestines can contribute to nutritional deficiencies because they hinder digestion and assimilation. And in fact, these bacteria inhibit the absorption of nutrients such as B12, vitamin A, vitamin D, vitamin K, iron, and also amino acids. Okay? So, who's at risk for this? I do want to circle back to that too, the nutritional deficiency thing. Who is at risk for this? Well, anybody who has type 1 diabetes, type 2 diabetes, a pre-existing gut condition, you know, Crohn's, IBS, I mean, you name it. It's really if you're anybody who is suffering from a condition, but also if you're taking medication of any sort. Antibiotics cause this all the time. Medications cause this all the time. Proton pump inhibitors, antacids, narcotics, I mean, you name it. There's a million things that can trigger it. But what are the symptoms? So if you're thinking to yourself, Dr. Zarowski, well, what's the symptoms that I have to look out for? So first of all, when I first got SIBO, one of the things that I noticed is that, like, I would wake up in the morning and my stomach felt like you could put a pin in it and just pop it. It just felt like it wanted to explode because I'd be so bloated, just wildly bloated. And it would actually hurt, like literally for the first, couple hours of the day, my stomach would hurt because I was so bloated. Now, symptoms of SIBO can be mild or easily mistaken for and attributed to another condition, while others can be severe and impossible to ignore. This is why SIBO can be difficult to diagnose. Any of the following may indicate SIBO. Okay, let's talk about some of these symptoms here. So I had a problem that started off with bloating. So we had abdominal pain and discomfort, bloating and abdominal distension, yes. Gas and belching, yes. Heartburn happens, yes. Fatigue, queasiness, diarrhea or constipation, IBS, inflammatory bowel disease, weight loss, anemia and nutrient deficiencies, brain fog, and mood symptoms. Some experience systemic symptoms including headache, fatigue, joint pain, and many other issues, okay? Now, what happens next? This is a good question. Now, this article pretty much ends here because here's the thing that you have to understand when it comes to just medicine in general, they don't really acknowledge that this is a big problem, and they don't actually acknowledge like there's a particularly good treatment path for it. They just do antibiotics, if anything. Well, here's what happens next. People who go untreated with this, it turns into a leaky gut issue, or also known as intestinal permeability. It turns into inflammatory bowel disease. As I mentioned in here, you just end up with a massive inflammation problem within the gut. You end up with nutritional deficiencies. Now, this article mentioned you have vitamin A, vitamin D, vitamin K. Vitamin E is one that they didn't mention that you can have a deficiency with as well. And what happens is you have a problem where these bacteria are going and eating the very nutrients that you need. Like, it's literally robbing you of nutrients. And so you end up with vitamin deficiency. I personally ended up with a vitamin A deficiency, which was leading to chronic eye pain. I had this stabbing eye pain, and oh my gosh, what is it? I was actually worried because, you start thinking about all the things it could be, glaucoma and all that. So I scheduled an eye doctor appointment, but before I went to the eye doctor appointment, because I didn't know what it was at the time, I decided I was going to run a nutrient test on myself. And this nutrient test is going to allow me to see all the different vitamin profiles so I know exactly what I got going on in my body. Well, it turns out I had an enormous vitamin A deficiency because, well, I had SIBO. Now, I knew I had SIBO at the time and I already worked to really start getting rid of it and everything, but the problem is that I was in the midst of a whole bunch of vitamin deficiencies as a result of SIBO. And by the way, any of these resources I'm talking about when it comes to the testing, when it comes to options to overcome SIBO, you can reach out to us and we can get you the proper information or head you down the right direction at the very least. So, I'll put some resources in the description below. Most of you who watch this know how to find me and know my clinic website and everything like that. So anyway, I started having all these issues and it was very frustrating to me. So I was able to take vitamin A at very high doses. It took very high doses, and I completely overcame the stabbing eye pain, which I was really glad about because I thought I had like glaucoma or something. And then the other problem though, and this is kind of backing up before the vitamin A deficiency thing became a problem, I started having skin rashes, which I literally just would break out in these big red patches on my skin. It looked very similar to like a rash you would get, like a candida rash. I also was getting random swelling throughout my body. I'd wake up in the morning and my hand would be swollen. My right leg would be swollen. I was getting these crazy immune reactions. And I was becoming sensitive to every stinking food on the planet. I mean, literally, you name it, it was happening. And it was so crazy because with this issue, it was causing so many problems. And like I said, the only solution that most doctors will give you is rounds and rounds and rounds and rounds of antibiotics, which causes more of an issue. So you could have SIBO, do antibiotics, and just due to the way that it kills pretty much everything, what happens is that the bacterial infection comes back stronger and stronger and creates more and more of an issue. And then eventually, they create inflammatory bowel disease. I mean, it's amazing to me. I can tell you so many stories. I don't want to go off way out in the weeds here, but I can tell you so many stories of doctors that have destroyed their patients' health. And then because of their negligence and not having knowledge of the issue that they went forward and put a treatment path to, without understanding it and giving these people medications or antibiotics. I mean, it's estimated that 50% of the antibiotics that are prescribed in the United States are wrongfully prescribed. Like the person didn't need it and the doctor's like, I don't know what to do, antibiotics. And so when they're doing these and then they create this massive inflammatory problem in the gut, from there, they end up putting their patient on medications. And I mean, they literally go and destroy their patient's health and then put them on a whole bunch of medications to manage the destruction they caused. Happens all the time. I mean, this is so common, it's ridiculous. So what is important to do is understand that you have this issue and then take the next steps in solving this issue, okay? Now, what do you do to solve it? Because we talked about a natural path. You have to make sure that you go in and you, first of all, clear out this bacterial overgrowth. You got to clear it out. You got to go through a clearing phase and clear this crap out, which is very, very important, wildly important, right? And then from there, you have to make sure that you look at all the different aspects, because we said earlier that this can happen from a whole myriad of different problems. Like some people say to me all the time, Dr. Zarowski, how did this happen? It can happen so many different ways. So maybe it's a pH problem. Maybe it's a probiotic problem. Maybe it's an ileocecal valve problem. Maybe it's a liver problem. Maybe the list goes on. Maybe you had leaky gut first. Maybe it is an immune system problem. Maybe you took a prescription that set this off. I don't know how it happened to you. That's what it comes down to. But at the end of the day, a lot of the same methods will remain the same on how to overcome it. So it really comes down to going through a multiple step process of clearing the bacteria out, improving the environment of the intestines, reducing inflammation, promoting proper probiotics within the gut. You just go through this process, and it takes time, and it takes a little bit of extra time depending on how severe your case is. People ask me all the time, Dr. Zarowski, how long will this take? It will take as long as it takes. Some people have severe cases. Some people have very mild cases. It's different for everybody. Some people can overcome this very quickly, and other people, it's a long time are a little bit of a longer term process to overcome it, because it depends on how bad it is. I mean, if your immune system's all messed up like mine was, and you probably have enormous amount of colon inflammation, I mean, you're in for a little bit of a process, and that's okay. The big part is that you get this problem resolved, because, anytime I have a patient who has had, gastrointestinal cancer, or they've had parts of their colon removed, what's the number one question I always like to ask them? Well, that is, how long prior to you having this extreme problem, like cancer, for instance, how long did you have this? How long did you have gastrointestinal problems that you are aware of? They all tell me, oh, geez, 20 years. Oh, since I was a kid. It's very common for people to know that they had gastrointestinal problems for years and years, but then they never did anything about it, and it led to extreme problems like cancer. And so, looking at this, we have to make the proper the proper moves, the proper changes. I'll put lots of resources to other videos I've done on this topic in the description below. Like I said, you can always reach out to us, shoot us an email, drop us a line, and then from there, we'll get you set up on the proper path in order to overcome this issue. But I do want to warn against the dangers of the traditional medical treatment for this problem. It is rounds and rounds of antibiotics, and it is awful, and it is very harmful. So share this video with a friend that you think that can benefit from it, and then also be sure to put your thoughts in the comments below, and check out some of the other videos and resources on my channel.